Looking back, I mean, I actually found a lump in my breast. That's how I was diagnosed. So I was playing on the ground with my daughter and she leapt at me and I actually leapt backwards and put my hands to my chest. And I wear a pearl necklace and I thought it was my pearl. And that's how I found a lump. But before that, in hindsight, now I struggled to gain weight. So I'd lost a bit of weight, although I was trying. When I stopped trying to actively lose it, I struggled to maintain or gain any weight. And I also had quite a few people comment that I had a jaundiced or like a yellow appearance, which was visible in my hands and my face. So they were my early signs. I wasn't on any surveillance before diagnosis. When I noticed the lump, it was in the middle of COVID when doctors weren't really seeing people in person. So when I called up and I spoke to my GP, she actually recommended that we leave it and come back to it in 6 months. I have a previous history of a liver adenoma, which is a benign liver tumour. And so I actually told her that wasn't suitable for me just in case because of my history. So I was sent for an ultrasound. After the ultrasound, about 2 weeks later, I was sent for a biopsy. And then within the week, I had the call to ask me to come into the doctors about my biopsy. So all within about 2 to 4 weeks, I was diagnosed with breast cancer. I honestly knew very little about anything to do with HER2. Breast cancer, I suppose, only really, I guess the stigma around cancer, you don't really know an outcome or the severity or anything like that. You start asking about staging and grading without really understanding what it means. And I found as well, unless I asked those specific questions, I wasn't really told a lot. So I did a lot of, I suppose, research on my own, but very analytical research, not a lot of emotion put into my research when I did it, so that I could, I suppose, have a more, I suppose, thought through perspective on what it was and being a bit more objective. Yeah. Given the treatments I've been through, so after chemotherapy, I was given a full pathological response. So that meant that my chemotherapy had completely worked, and when they actually removed the cancerous tissue, it was no longer cancerous. So all traces of cancer is gone. So very, I suppose, it feels like everything I've gone through is now worthwhile, given that I am, for all intents and purposes, cancer-free. Yeah. Yes, so I see a specialist every 6 to 12 months. I'm still undergoing treatment, I suppose, in the fact that I've got one more surgery to go. So I've had 2 surgeries and I have one more remaining, which is actually next week. And after that, I will see somebody every 6 to 12 months, and then it becomes 12 monthly with your oncologist. But I don't have blood tests or scans or anything like that at all. It's just simply finalising my surgery. So when I was first diagnosed, I was sent to a local breast specialist who then, I suppose, looking at my pathology report from the biopsies, told me what I was in for in terms of, so I call it the works, so chemotherapy, surgery and radiation. And after that, he sent me to an oncologist. So I had, I suppose, in terms of my treatment, it went chemotherapy, surgery, radiation, surgery. So I knew what I was in for in terms of that, which was really good in hindsight, knowing the steps that are to come, rather than thinking, we have chemo and then we'll review it. Knowing straight up what I was in for was helpful for me. Yeah. There wasn't a lot of, I suppose, conversation. It was more providing their professional advice as to what would provide me with the best outcome given my specific diagnosis. Um, so each specialist I went to, I also went through the private health system, and I also had time, I suppose, to process things rather than I do have acquaintances who were rushed straight to surgery, and so they didn't have time to process what could be happening to them or what it could look like or asking different questions. I actually had a couple of events coming up, so I told them I wouldn't start treatment until I had got through these events. And so I had 1 to 2 months, to actually process what was happening, which for me was good as well. I did check before doing that there would be no detrimental effects by prolonging treatment for another couple of months, and they said no. Had they've always said we recommend sooner, or and I was also told, treatment is up to you. So it was very much so made sure that I felt I was in control of my choices as well, not just this is the plan, any questions or anything. It was, yeah, I've been very fortunate. So I suppose the only side effects I really have of treatment is, apart from the scarring and things from surgery, is I suppose future factors. So things like your bone density and different conditions that come up along the way. Initially, it was just to survive. So anything I had to do to survive was what I was going to do. I have a daughter, and so I was willing to do anything that I had to make sure that all that mattered was first that I survive. After that, then it's quality of life. So I don't have any physical limitations, and all I have is numbness in the end of my toes, really, which is related to HER2, so the Herceptin that I went through, so targeted therapy. And that's really my only limitation. Given my age, I haven't really had to have those discussions. Again, I think I've been quite fortunate. I was in a physical health, apart from cancer, I was in quite a good condition to be dealing with what I was going through. I guess the only other consideration would be in terms of fertility. So not knowing the outcome there, all they can really tell me is that due to my age, so I didn't save any eggs either. So whether I can have another child, should I choose to later, is questionable, but that's a hurdle I'll deal with if and when I come to it. I haven't participated in a clinical trial. I did ask about them, but I don't have the BRCA gene. And given other trials that I looked at that were actually around at the time were usually different age brackets, so I just wasn't applicable for any of the trials at the time. So my decisions about treatment came down to, firstly, whatever would provide the best outcome. And then, of course, family considerations. I work full-time, so there was work considerations. They're probably the top 3. I would say it's slightly changed, given, I suppose, my current outcome to date. I've always asked for things, or as things have gone along more and being more open to understanding things in my own choice, questioning things a bit more, trying to understand them. Things like statistics for me are important because but that comes down from your oncologist because it's specific to me. It's not something that you can Google and look at that's generalized. And so that did help me make decisions moving forward for my own treatment. I've had 6 months of chemotherapy. I've had 12 months of targeted therapy. 5 weeks of daily radiation. And I've had 2 surgeries and 1 more surgery to come next week. So that's my full treatment. I was also recommended to go on a daily tamoxifen for 5 years, and I've declined to do so for quality of life. To feel like the treatment has worked, you definitely like to see some type of results, or something written on paper that can tell you that the change has been made, which I received. So the rest of the treatment after the first surgery was basically, and when I'd been lucky enough to have the full pathological response, had been making sure it doesn't then return. So everything else is now preventative, and whatever will give me the best quality of life moving forwards. I suppose one of the negative effects of being diagnosed at 29 is that you do have a full lot of life ahead of you to try and live through, and that's just making sure that you can live the best life possible. Yeah, absolutely. I mean, if the treatment didn't do its job, I think I'd have a lot of anxiety. Is it coming back? Is it going to get worse? There would have been more potentially chemotherapy involved had I not had the full response in the first instance. I know that was an option, and it was just pending the results as to what next steps were at that time as well. So it was a pretty joyous day when I received my results from the chemo. Yeah. Information that's been the most helpful, it's definitely been anything specific to me. Anything generalized, anything you can Google, anything you can get from a group, I wouldn't recommend looking at. I never joined Facebook groups or anything like that. I wanted my experience to be my own, and I didn't want to go into it with any conceptions as to what may or may not happen. So I just, and making sure all of that information comes from absolute professionals and specialists. Don't go asking about your friend or your friend's friend. Go to your oncologist and ask about your specific diagnosis. Probably most able to take information in probably a couple of months in, once treatment started and there's not that, I suppose, anticipation and fear as to what's going to happen, what's it's going to be like, what will, your effects be. Once you're in it, then you can kind of settle and you start to, you process things and question things more. You are given a treatment diary when you go through chemotherapy, which has a section at the back for questions. So every session I would go in with different questions. I'd just write them down as they came up in my head. And I've never gone in and asked a question that I regretted asking. For me, that information was valuable to ask rather than to ponder it and Google it and, have incorrect information. So definitely as things go along, I'll probably give it a couple of months to sink in and then get your teeth into some questions. Personally, it's been quite good and quite professional. There are breast care nurses who come and see you as you're in and things like that. I've had, things like Dot's Place or Cancer Council supports contact me or even text me and say how things are going. It's been really, really good. You do feel supported, but it's definitely up to the individual to be open and accept those supports as well, because they are there, but they won't come knocking at your door constantly. So if you don't want to be interrupted, you can politely decline. But all professionals for me have, the specialists and things like that, they've been highly professional, answered all of my questions, and quite genuine as well. I think I haven't had anyone who's not empathic. and the nurses at the cancer ward are just beautiful. You can't ask for more than that. Yeah, so looking at costs and finances, it was probably one of the most stressful things as I now as a single parent as well. I was the primary worker at the time, so I worked full time. One of the medications I was recommended in terms of chemotherapy was not covered on the PBS. And so that cost me $7,000 out of pocket. But with a extra 10% of long-term survivorship for me was worth it. To get things like that though, I was very lucky to be able to lean on some family members. I withdrew from my superannuation. I refinanced my home. So it hasn't been without costs. Overall, everything considered, which doesn't include the fuel for traveling to Perth and things like that. So I'm based down in the southwest. I'm looking at $80,000 to $100,000 to cover everything that I've been through. Yeah, absolutely. I think anyone diagnosed with any form of disease takes a toll on their mental health. I suppose I was a bit proactive with that. I started going, is this going to affect me later in life? I know of a lot of people who get a little bit of almost PTSD symptoms as to, will this recur? Will it keep coming up? I haven't experienced any of that myself, but proactively I see a clinical psychologist about once a month or so. I started going in and just going, I've been diagnosed. Is there anything that might pop up? What do I need to do here? And just starting from there. So that was the approach that I took. But I'd recommend anyone in a similar circumstance, I think family members are affected more than they like to say as well, because they're trying to be there and strong for you. And so seeking those supports, not just for yourself, but your family members and maybe even your children, anyone who might be more affected than you realise. It's been probably one of the best things that I've done. Yeah, so my diagnosis definitely did. Halfway through chemotherapy, I went through a divorce. So my marriage separated, and I started single parenting. But in terms of, I suppose, my family, I'm in a new relationship now, which is going really well. My mum's been more supportive than, any person can expect a person to be. And the relationship formed between my mum and my daughter has just been second to none. So mum's been there for us throughout the whole thing, taken time off work to have my daughter when I was away for surgeries and everything like that. And also the support of my brother and my dad coming to help with, anything they could. Being not located close by, things like they've really helped with costs and things like that. And just being there, the connections have grown really strong. And I feel like there's something that's almost now unbreakable that wouldn't have been there without this diagnosis. Probably, definitely from what I've experienced, it would be costs. As a person that works full time, and I've always paid my taxes and done the right thing. Even when other, say like the Cancer Council, tried to assist me in seeking supports, there was nothing for me. I also did things like put my mortgage on hardship and all types of things to afford the medical costs. And so I think it would be beneficial if, anything was covered that could have been more covered, while still retaining your choice in you treating professionals. So I had, going privately, had a little bit more, I suppose, choice as to who I went to and where I went to. And I think every person deserves that regardless of cost. Honestly, I think everything's been very good. I don't know what the supports would be like if I was, physically impaired or further mentally impaired or something like that, and unable to get myself to and from appointments. So I drove to and from my own chemos and things like that. So I'm fortunate to be able to do that, and all of my treatment centres are quite close. Had there been distance involved and things like that, that could have been a completely other story. And I do know of people who have had to stay in accommodation, things like that, and none of that's supported or costs are covered. And so that for me would have been just additional strain that would have been really difficult. Definitely. I think understanding the amount of research that's gone into breast cancer and the potential outcomes that come with that, for me would have been good to know. You kind of go in quite blind, and unless you go looking, which, can come with its own dangers if you're looking at incorrect information or misinformation or even outdated information, it's hard to know where to get the right advice. Or, people still can't really tell me why I got cancer, and some of those types of questions that can never be answered. Information around those would be great, but that might be like a genie in a bottle. So, yeah, it's just knowing that, like, the big C isn't what it used to be. I think in my head it was like, when you're diagnosed with cancer, that is it. And instead knowing that there is another world after cancer that, you can make the most of if you wish to.
So would this have changed the way you make decisions?
Would it have changed it? No, because I was still committed to doing everything I did to survive. And I don't think that would have been approached any differently should I have thought there was a potentially positive outcome. I would have fought regardless. I think the most important thing to understand is that the effects it has on a person goes past physical, and it's very mentally driven. And so there's a lot of supports provided for people to relax and, have some sort of supports. But in terms of, did I not have the family to lean on that I did, or the supports that I already had, I don't know that what's provided would have been enough. The costs that I've endured, should anyone else not have been in such a fortunate position and not had as much choice in their care, that would have really concerned me. And I think it's unfair that any other person or human being going through something that I've been through, who, for no real intents or purposes, no one elects to get this put on themselves, how they could have struggled having to, pay for something that could improve your survivability by 10% shouldn't even be in question. If there's other people who couldn't genuinely afford that, of which I was fortunate enough to reach out and have that paid for me from a family member, even I don't think I could go back now and get that done, but I was fortunate enough at the time to be able to do that. So I suppose definitely more funding and supports, and the accessibility of complementary services.